How do you know if your back pain is serious? Now, obviously, any pain that has been going on for a long period of time or has a significant impact on your life or your movement or your ability to exercise is serious. But what we're talking about here is medically serious back pain that needs immediate medical intervention. So in this video, we're going to go over the red flag symptoms that are worth knowing and paying attention to, just in case you happen to fall into this small category of cases of back pain that are more medically serious. Welcome back to the channel. My name is Dr. Nate. I'm a licensed doctor of physical therapy and the founder of BackUnbroken, where we help people get out of back pain every single day. So if you're struggling with back pain and you want a straightforward approach that actually tackles this issue for good, make sure to check out the link down below. Now, before we get started, I just want to say that this video is not meant to replace actual medical advice from a licensed provider. If you're concerned about any of these red flags or your situation in general, it's important to talk to a licensed medical provider and to get specific advice for you. But I think it's really important to know what these red flag symptoms are, not just so that you can get the proper medical treatment if you happen to have them, but also to give you some more confidence and ease of mind if you don't have any of these symptoms and you fall into the 95+% of back pain cases that aren't medically serious. I've been through this personally, and I know how scary it can be to imagine what's going on in your back and if it's something really serious that needs to be taken care of immediately. The good news is that that's not the case for most back pain, and most people are not going to present with any of these red flag symptoms. Now, if you do have some of these symptoms, it doesn't automatically mean that you have a more medically serious case, but it probably means that it's worth going through some extra tests and ruling out some of those more scary diagnoses. So with all that being said, let's get into the actual red flag symptoms to look out for. The first one is a sudden onset of unexplained weight loss that coincides with the back pain. This generally means that at the onset of your pain, when it first started, you also started experiencing completely unexplained weight loss at the same time. Now, this is usually not a small fluctuation of just a couple of pounds. It's usually a more sudden, dramatic, and sustained weight loss that coincides with the back pain, and it can't really be explained by anything else. The next one is any signs of infection, so fever, chills, or night sweats that coincide with the back pain. Now, you can see why these aren't definitive signs, because if you have back pain and then all of a sudden you get the flu, you might have some fevers, some chills, you might even have some weight loss. But that doesn't necessarily mean that you have some kind of red flag symptom that would necessitate medical intervention on your back pain. In that case, those things are all just occurring at the same time, but it doesn't mean that they're all connected. Next red flag symptom is a history of cancer or ongoing cancer treatment. That one's pretty self-explanatory. The next one is a loss of bowel or bladder control. If you notice sudden weird changes in your ability to go to the bathroom, that might be a red flag symptom. The next one is numbness, tingling, or progressive weakness in both of your legs. Now, it is really common to have radiating pain or symptoms down one leg. You might have some numbness, some tingling in the back of your thigh, in your calf, down to your foot, and that doesn't necessarily check the box of a red flag symptom. But what we're looking for here is if you experience that in both legs, or especially in what we call the saddle region. This is sort of the inner thigh area or any piece of you that would touch a bike seat. Another probably more obvious red flag symptom is if your back pain starts suddenly with a traumatic event like a fall or a car crash. It isn't always the case that you have something more serious like an active fracture if you have some kind of traumatic event or fall, but it's always a good idea to rule this out with imaging if your pain comes on suddenly with some kind of physical force or traumatic event. This next red flag is a little bit trickier. This red flag is constant worsening pain that doesn't improve with rest and might even get worse specifically at night. Now again, this one's tricky because a lot of people will have pain in the night or in certain positions, or they'll notice that their back pain slowly gets worse over time. But again, the clear distinction here is that the pain comes on and it just progressively gets worse and worse and worse, and no positions or movements seem to relieve it, and it has this weird specificity where it gets specifically worse at night. This is one of those symptoms that a lot of people will assume they have, or they'll sort of self-select that they're in this category, but don't end up having any of the diagnosis or serious medical conditions that would lead to something like this. The last red flag we'll cover here is significant leg weakness or things like foot drop. Now again, it's pretty normal to develop back pain and to have your strength go down over time, especially in your legs. But the key distinction distinction here is that this is usually progressive neurological weakness that can't really be explained by normal atrophy or lack of activity. Like in the case of foot drop, where your foot's natural resting position is in a flaccid, weakened position. Now, this list is not exhaustive. These are just the most common red flag symptoms that we want to look for when it comes to back pain. And again, having one or a couple of these symptoms does not automatically mean that you have some kind of serious medical condition that needs immediate attention. It's more so when you have multiple of these red flag symptoms all going on at the same time, and the whole story just doesn't make sense from a general back pain perspective. That's when it's worth going through all the due diligence of checking these things and ruling out any more serious medical complications. But again, the good news is that over 95% of cases of back pain will not fall into that category. And therefore, in most cases of back pain, there isn't something super specific or scary that we have to go after, and you're better off taking a conservative, slow, progressive approach for most things. This might include working on your back tolerance, your range of motion, your strength, your ability to move, and addressing your nervous system's sensitivity threshold to pain, which often gets lowered in cases of long-term chronic back pain. If you want to learn more about this, or you're really ready to say goodbye to back pain for good and you want a step-by-step process for how to do that, I would really encourage you to check out what I do at Back Unbroken. I'll leave a link down below. There's a full video on the page explaining how everything works and why this is such a big issue. And you can start a free trial right away to give it a shot if you think it's the right fit for you. Either way, I hope this video was helpful and can steer you in the right direction when it comes to your back pain. And if you want to learn more about herniated discs and whether or not those are something that you should be worried about or whether or not they heal on their own, feel free to watch this video right here. I'll see you in the next one.